Hello friends, welcome to my dental world. This is Dr. Bhothini. So today's video is mainly about oral tips during pregnancy, generally for ladies. Okay, so first and foremost thing what the pregnant woman should not avoid is bleeding while brushing. Okay, this is the one of the major sign that you should consider during pregnancy, because pregnancy can induce gingivitis. That is, it is a physiological it's like a physiological phenomena, it happens due to pregnancy. Okay, while in pregnancy there are so much of body changes happens. Okay, so one among them will be the pregnancy induced gingivitis. So everything, each and every problem has a solution. Okay, so go and clear with your dentist. Okay, get your scaling done. Okay, whatever may be the prophylaxis, please carry on. And at the same time, one thing you should focus is pregnancy induced gingivitis is not a like a it's not a great deal. Okay, you can just go and consult with your dentist and get cleared it out. Okay, have a routine checkup until your baby is born. Okay, during the pregnancy phase as well as after the pregnancy. Okay, after the delivery, that one thing is pregnancy induced gingivitis may cause some irritation as well as gum bleeding, and as well as it should disturb the mood of the pregnant lady. So you can better clear with it, and at the same time you should not worry much about it. Okay, your dentist are there to protect you, to take care of your oral hygiene. So your dentist is there to clear all your solutions. So get it done right now, don't delay further. Okay, thank you so much. Subscribe my dental world, and a few more videos are yet to come. So kindly pop it. Okay, kindly click a like button, share with your friends, so that it will be more helpful for those who need. Okay, thank you so much friends.